Everybody, Namaskaram. I am Dr. Sai Ravisankar. I am the senior consultant cardiologist working at SLG Hospital. I am right now the head of the department of SLG Hospital. We have a good team. As I told you, I am the head of the department. We are having a 4-member team with a good cardiothoracic surgeon and CT surgery. We are almost 24/7. All the cardiology services are available. So today's topic is heart disease prevention and treatment. So first, let me start with what is heart disease. Heart disease is nothing but in the heart there are 3 blood vessels are there. So 2 right and 1 left. If any blocks into the blood vessel, then it will reduce the blood supply to the heart. If the blood supply to the heart is reduced, heart will not get proper oxygenation and proper blood supply. That part of the heart will be damaged. If it is 100% block, then heart muscle will 100% it will damage. The damage will start from something around 2 to 3 hours immediately. So it is an irreversible damage, and if you treat within 3 hours, it will be a reversible damage. So heart disease is nothing but blockage in the coronary artery, that is blood supply of the heart. So what are the causes of heart attack? Heart attack is not immediately it will come. It's a atherosclerotic process will start for a decade, maybe 2 decades. So lipids, that is a cholesterol, will be deposited in the blood supply and it will grow and lipid core, then it will block the coronary artery. It cannot be within 1 day. So it will take some years, maybe 5-6 years or maybe 10 years. But suddenly if the lipid core, the plaque ruptures, it will totally block the blood vessel. Then patient will develop chest pain, breathlessness, all the symptoms of heart attack and land into heart attack. So the causes are modifiable risk factor, non-modifiable risk factor. There are modifiable risk factors are there, which is a smoking, sedentary lifestyle and obesity. That is what sedentary lifestyle will cause obesity. Few of these are hypertension, diabetes and hyperlipidemia, means more cholesterol. So smoking, obesity, that is inactivity, physical inactivity, diabetes, hypertension and lipid profile, the high lipids are the major cause. Recently, we have found that there are few of the important interesting points. We found that in young hypertension, young heart attack, stress and strain plays an important role. Stress and strain, which is now which we are working in the hospital where more IT guys are there. A number of cases we are getting young hypertension where mental stress is very important. So stress and strain, pollution level and lack of sleep. This is considered now is one of the emerging risk factors for the heart attack. So these are the few things for modifiable. Non-modifiable risk factor like age, family history of heart attack, you cannot modify that, and some genetic factors. So if you control all these things, and proper diet is a modifiable risk factor. The junk food, now everybody is addicted for the junk food where more cholesterol will be there. These are the few things by which atherosclerosis will progress and lipid deposited in the coronary artery and patient will develop heart attack. So how to find out the heart attack? What are the clinical symptoms to heart attack? Patient with some risk factor like hypertension or diabetes or more cholesterol, or patient is a smoker, for them any chest pain left-sided chest pain preferably, and radiating to the left hand, and breathlessness. So chest pain, breathlessness, and left hand, the radiating to the left hand, and sweatings, perspiration. This is the first and foremost important for any heart attack symptoms. The chest pain typically left side, but it can occur in the back side of the backside, or the angle of mandible, or the throat pain, or sometimes in the epigastric region. So if you are having any risk factors, don't hesitate, immediately go to the nearest center. If the ECG, take a ECG, simple ECG, or any TROP-T test or any biomarker, then confirm whether it is a heart problem or not. Most of the time it may not be a heart problem, maybe a gastric problem, maybe a muscular problem, but 1 in 100 may be a heart. So don't neglect yourself. Why? The very important theme of a heart attack is a golden period. If the golden period, if you are reaching the hospital nearest cath lab center where the 24/7 cardiologists are available, if you are going there within 1 hour, that's what we call as a golden period. We can immediately remove the clot by thrombosection and primary angioplasty, number 1. If at all not required, we can give intravascular thrombolysis. By that we can dissolve the clot and we can restore the coronary supply, blood supply. We can save the life. We can save the heart muscle. So time is heart, and time is very precious in any heart attack. If the same patient comes to us after 6 hours, most of the heart muscle will be damaged, and patient may lead into all the complications like heart failure or arrhythmias. So to prevent all these arrhythmias complication, the golden hour is to reach the hospital within 1 hour of the symptoms. And we have also a golden hour that like door to balloon time, door to needle time, and door to balloon time, we have a fixed. So as early as the possible, we are immediately treating the patient. The modality of the treatment, which I have told, there are few modalities of treatment. First, there are few drugs we are giving for the antiplatelet, blood thinners, a loading dose, and followed by the patient is stable or not, we have to find out. If the cath lab is there, the gold method is the primary angioplasty, where we do the thrombosection and remove the clots and put a stent. That is what we call as a primary angioplasty. That will save the life. Otherwise, the patient is away from the cath lab center, they can go to a nearest physician where they can give the intravascular thrombolysis. That is also almost 60 to 80%, it may dissolve the clot. Followed by we have to do the angiogram within 24 hours to find out the clot has been dissolved or not. So there are two modalities which I have told. One is pharmacological and another is invasive method, and there is a in between is a pharmaco-invasive therapy. We can adopt even a pharmaco-invasive therapy. Our utmost important is to save the life, save the heart muscle. That is very important, and by that we can prevent the complications. So the modalities which I have told, we have very well equipped hospital where 24/7 we have a cardiologist team, 4-member team are there. We do all sort of complicated angioplasties like rotablation, bifurcation lesion, CTO, IVL, and all sort of non-coronary. We are doing all pacemaker, leadless pacemaker. We have a dedicated heart failure clinic where we are dealing with purely heart, and we educate how to deal with heart failure patients and what to do and not to do, do's and don'ts. So we have all the latest modalities which is available in India. The last but not the least, how to prevent heart attack. So I can tell prevention is better than cure. So to prevent heart attack, we have to change ourselves. Our mindset, we have to change ourselves. Whatever you are taking the diet, you just think before taking the diet is suitable to me or to my heart or not. I request you, avoid junk foods, avoid fast foods. Take as much as vegetables, take as much of fruits. Taking a fish is okay, white portion of the egg is okay, and as much as possible, these are the things you can avoid. So food is important, avoid junk foods and the fast foods. Second, if you are a smoker, it's the best time to quit smoking right now onwards. Don't wait for the tomorrow onwards. Third, do some sort of exercise. At least 10,000 steps per day, 6 days in a week, or 45 minutes per day exercise. That is a very important thing for you. So do some sort of exercise. Physically inactivity is a very important, and waist hip ratio is a very important marker for the cardiovascular disease. So if these are the things you can in your hand. Number 4, if you are hypertensive, please go and check your blood pressure regularly and follow the medication which prescribed by the physician or a doctor. Your target blood pressure should be 130 by 80. If it is taking by medicine, if it is fine. If it is high, then immediately consult the doctor. Your target should be 130 by 80. If you are a diabetes, please see that your sugar level is under control. Take as much as non-carbohydrate diets and do regular exercise. If you are having a high cholesterol level, again please consult any cardiologist or a physician. Please see that your lipid level is under control. The lipid level, LDL level, is the most culprit, where we define LDL level different to different patients. If the same patient comes to me with acute MI, the lipid levels should be less than 55 or around 55. If the same patient comes to me for the diabetes only, lipid level something around 70 is my target. So lipid level, LDL level different to different patient. So for that, don't believe the lab reports, because you are not into that. Every patient is different, individualized, and this is a purely physician will decide. So with this lipid level, you have to go to the physician or a cardiologist and find out what is this treatment really necessary. Either a pharmacological treatment or a lifestyle modification, the doctor has to decide. So these are the important where you can prevent your heart attack. So recently we have done the World Heart Day. It is your heart. Please listen to your heart. It is in your hand. The disease is, you can prevent almost 80% if you do a simple tips and tricks. Please follow some of the tips and tricks of the heart attack. How to prevent it is 100%. It can be achievable. Thank you. Thanks a lot.